joint, an intricately engineered component for any movable structure. Our body consists of many joints that impart mobility to different parts of the body. When a joint is not healthy, our body may suffer from immobility, or worse, we may experience pain and a chain of ill effects in our body. A typical joint between two bones consists of cartilage at the tip of the two bones. The cartilage is elastic and is able to absorb shock and reduce friction. When the cartilage is not healthy, the person may experience pain and stiffness in the joint. If the situation becomes more severe, the bones could rub against each other, resulting in more pain and even deformity. Gradually, if the problem worsens, the person may be incapacitated. In the case of the knee joint, the person may be on walking stick, wheelchair, and ultimately bedridden. Care Nexus Sendirian Berhad proudly presents to you the Cytotron. Cytotron is a first of its kind treatment machine using the latest cutting-edge technology to bring about tissue repair, regeneration and degeneration depending on the objective of the treatment regime. It is scientifically based on a complex technology known as rotational field quantum magnetic resonance technology, or simply RF-QMR. This machine generates high-power, multi-frequency and high-energy spinning quantum electromagnetic beams in the sub-radio and near-radio frequency spectrum. The Cytotron will project precise amounts of these beams at the target tissue area that needs to be treated to bring about change in the cell membrane potential of the tissue cell, thereby inducing changes in cellular activity. In simple terms, by changing the potential of the tissue cell, tissue growth or tissue death can be stimulated. Tissue growth stimulation can be applied in the regeneration of tissues such as cartilage, as in the treatment of osteoarthritis.
Regeneration of cartilage has been clearly shown in the X-ray of osteoarthritic knee. Before the Cytotron treatment, the bones were practically touching each other. 3 months after the Cytotron treatment, increased thickness of cartilage had widened the gap between the bones.
The Cytotron is invented by Mr. Raja Vijay Kumar of India. He is currently the Director and Chief Scientific Officer of Center for Advanced Research and Development. As a specialist in science and medical engineering, Mr. Kumar has been working for more than 15 years on regenerative tissue engineering and high-speed biological data acquisition, modeling and simulation of the cardiovascular system. His research findings have not only broken new grounds but also find wide applications that break the barrier of different sciences. Mr. Kumar has researched and worked on RF-QMR for more than 10 years. With his innovative application of RF-QMR to medical science, Mr. Kumar has demonstrated that cartilage can now be regrown with the Cytotron, resulting in the healing of osteoarthritis. To date, more than 500 cases of osteoarthritic patients have been successfully treated with the Cytotron. In his recent book, Cytonics, A Mystery of the Living Cell, published in 2006, Mr. Kumar elucidates the theory behind RF-QMR and its applications. In the words of Dr. Raymond Damadian, the inventor of the MRI scanner, Mr. Kumar's pioneering work brings to life new technologies for coupling the early MR detection of cancer tissue to efficient methods for eradicating them.
The Cytotron treatment is a non-invasive and non-surgical procedure. The Cytotron treatment for osteoarthritis consists of 30-minute session for 21 consecutive days. Prior to the Cytotron treatment, preliminary examination with MRI or X-ray will be necessary.